Hello, shalom, welcome. Today's the 28th of October 2020, slap bam in the middle of the second wave of the 2020 pandemic, and welcome to my new blog, Walking on Water with Dr. C.A.Botchway Jr. Today's topic is, what does dental anxiety and dental phobia have to do with your destiny? Let's get started. Okay, now you may have experienced the soul-crushing terror that is often called fear of the dentist, phobia of the dentist, anxiety of the dentist. It is a terror so paralyzing that your heart thumps in your chest like a prisoner desperate for freedom. Your mouth turns into an arena that is akin to the dry sands of the Sahara Desert. And every rational thought that you had rehearsed for days, even weeks, prior to the appointment evaporates right before your eyes. It's gone. Nothing matters as you tear out of that waiting room, almost knocking over the ultra-friendly practice manager who's trying to reason with you at the door of the waiting room. Forget about the people staring at you. Nothing matters as you bolt out of there, sprinting for dear life, gasping great gulps of air, ignoring the alarm stares of strangers passers-by as you tear down that long corridor of the medical building, literally flying across the parking lot, never looking back. Never stopping until you are barricaded in the safety of your car and the door is locked firmly. Sound familiar? Look, even when that timid little knock on the glass of the car window startles you back into reality and you look up only to see the concerned face of the ultra-friendly practice managers who's followed you, you only cautiously roll down the window far enough for her to pass through the wallet that you left at the front desk. Legitimate enough. As though you think that she might somehow actually manipulate her way through the 2-inch gap and try to extract that tooth herself. And you don't fully exhale until she's disappeared back into her dental office. Sound familiar? It's a horrible, demoralizing experience. If it's ever happened to you or you've ever watched it happen to someone else. And you may have experienced this terror that strips you of control, of self-esteem, of peace, of dignity and power, leaving you wondering what on earth is wrong with you and why you can't get over your terror of the dentist. Sometimes people actually begin to spiral into a state of hopelessness, thinking and believing that there must be something wrong with them. Surely they must be less than those who don't have dental anxiety, right? Ever happened to you? You may have tried many things to overcome the dental anxiety. You may have even spent a lot of money. You may have to alleviate the fear and the terror, sometimes to no avail. You may have tried to have your work done where you're not conscious and you wake up and it's still there. In fact, worse still, your friends and families and co-workers, well-meaning, may have told you story after story after story about their personal great dentist. They may have told you their dentist is so kind and gentle, and they may have explained to you how different the procedures are nowadays, and they may have even explained the procedures in great detail and even introduced you to the kind and wonderful dentist. So why do you still throw up in the bin and race for the car without ever having the work done? Do you know? And why do you invent 1,000 excuses to cancel short notice, which, by the way, the dentist does not like at all, neither the practice manager, leaving yourself feeling even worse about yourself than before? Do you know why? Because you never intend to. But do you know why? Shalom, my name is Dr. C.A.Botchway and I am a general dentist who has been practicing dentistry for over 27 years. In that short time, I've been honored to work with many anxious, phobic, and terrified patients, and not just learn on the job what dental anxiety is, but also to assist in empowering them to overcome their dental fear once and for all. Listen carefully to what I'm about to say. It might help. So let me summarize. Fearful dental patients are not fearful because they are ignorant of procedures. Neither are they fearful because they require an extra dose of sweetness and kindness in their dentist. In fact, you can overload a fearful dental patient with waves of information about the procedure, swaddle them in care, kindness, and patience, and they may well still be paralyzed by the fear. And this is because it is not ignorance that is in action in the path of a phobic patient. Neither is it a deficiency of kindness and care that triggers them into terror. Showing and telling them will avail little if it is done in isolation of the actual key factor that is in full play in every fearful dental patient. This key factor, which has often been mistaken for ignorance, for lack of kindness, for lack of knowledge, lack of modern advanced equipment, must be clearly identified and targeted before the dental fear can be dissolved step by step. And because this key factor exists and resides within the actual patient themselves, it is the actual patient who has to become empowered in order to eradicate it, to take it out. The key factor that is underlying the cause of all dental fear is belief. Belief. It is belief.